Fetal medicine is a parcel of modern obstetric care. Obstetrics means pregnancy care. Now, what is fetus? Fetus is basically the name which is given to an unborn baby while it's still within the mother's womb. And any medicine that deals with the health of the fetus is called fetal medicine. This is a concept which has happened very recently, because people are becoming more and more aware about the unborn baby. Gone are the days when people used to have 4 or 5 children. Nowadays, couples are restricting their children to 1 and 2, and therefore, more than the number of the children in the family, the quality of the children is becoming very important. And that's why the specialty of fetal medicine is becoming more and more. These are special groups of gynecologists who train themselves and are passionate about looking into the mother's womb to find out whether the baby is okay or not. The baby stays within the mother's womb for about 9 months or so. This 9-month period is usually divided into 3 phases: the first, the middle, and the last phase. The first phase is important because that is the time when the major organs of the fetus are growing, and any problem during that time can cause an abnormality of the fetus, and there can be genetic problems as well, like Down syndrome, thalassemia. Sometimes we diagnose twin pregnancy, about 2 to 3% in all pregnancies. And then we all know that twins can be of 2 types: dichorionic twins, which are separate twins, or identical twins. The other one is identical twins, and they have their own type of problems, and they have to be monitored very well. Now, apart from these, there are certain genetic problems as well which can be found out, both which can happen in the family and otherwise without the family history also. The middle part of the pregnancy is important because we can find out structural abnormalities of the fetus, like the heart, the lungs, the kidneys, they're okay or not, the stomach, the hands, the feet, because these are very important. And in the later half of pregnancy, we are more concerned with the growth, whether the growth is okay, whether the baby is developing okay, whether the baby is becoming small or the baby is becoming too large, whether sugar is developing, thyroid is developing, whether the mother is developing hypertension, high pressure or not. So these are certain things which we fetal medicine specialists look into the fetus all the time. Now, majority of the problems that happens both in the mother and the fetus usually happens accidentally, usually happens without any notice. In more than 90% of cases, the mother and the fetus are usually okay. But it is the 10% of cases which actually causes concern. And that's why it is very important to look after the pregnancy right from the start, not only from the start, for even before the start. Because before the pregnancy happens, there are certain things which can be taken care of and which actually helps in ensuring that the pregnancy, mother and the baby are fine at the moment. The dream of every couple, every family in the society, nationally and internationally, is to have a healthy mother and 1 or 2 or few children which are healthy in each family. And that is the dream that all of us have, not only the patients, not only the family members, but we doctors as well. We fetal medicine specialists, especially in Institute of Fetal Medicine, Kolkata, constantly strive to achieve this aim. We try to make sure that we find out the wellness of the baby rather than the illness of the baby. Illness happens only if the wellness is ignored. So I would request all the people to actually go through a routine scanning procedure, routine blood tests, routine counseling sessions, especially genetic counseling centers as required, and then take care so that the dream is fulfilled. The whole idea about a marriage, the whole idea about a family, the whole idea about a happy family is now possible through fetal medicine and its proper application. And we at Institute of Fetal Medicine constantly try to achieve that. Thank you.